Good day, Warren County residents. It's another beautiful springtime day across the community and the sun is shining, but the crisis is not over yet. It's sometimes easy to forget that over 750,000 COVID-19 cases nationwide have been detected, with over 41,000 deaths. Numbers are still coming in and tests are being conducted across the state. Preliminary results show that the number of those infected may have been undercounted. Health experts warn that until more reliable tests are in place, antibody markers are identified, and a vaccine is available, we are still not out of danger. Warren County does have 5 confirmed cases. Testing continues at the health department with the help of the Tennessee Guardsmen, and we're awaiting the results from hundreds of tests that have been conducted over the last few weeks. Shutdowns continue until April 30th across the state. Governor Lee announced yesterday a relaxation of business closures at the beginning of the week, and we do not know what the full scope of those plans are yet, but more information will be coming from the governor in the next few days. He's asked for input from our local economic task force to help in the reopening strategies. Tourism Commissioner Mark Ezell is in charge of the governor's recovery strategy program. Input from our chamber, our business roundtable, our Main Street McMinnville group, our downtown merchants, and local community leaders has been shared with the state. That input will be used to develop a transitionary, phased-in approach to reopening the Tennessee economy. Our governor, however, is still emphasizing social distancing and taking precautions. I commend each and every one of you who has complied with the masks, with the social distancing, and staying at home. We want to remind those that don't follow the rules and the guidelines that you are jeopardizing the safety of others. It is all about those choices. Most of you remember that in my economics classes, that poor choices can cost you a lot. As you know, financial assistance is finally arriving from Washington and being distributed across the state. It is not a fix-all for many of the challenges ahead. Small businesses will still have to rebuild. Bills will have to be paid, and lives will have to adjust to this new normal. State and federal grant monies may not be enough to correct the situation at hand. It will be left up to us in Warren County, local business leaders, the chamber, and others to implement our own plans for recovery. With your help and support, I am confident that Warren County will rise again and will be stronger than ever. My preparedness team continues to share information and implement strategies in the next phase of this pandemic. There are challenges ahead, and information from conference calls comes in daily that we monitor and adjust to. As your county executive, I am committed to serving the needs of each and every one of you in this community. It has not been an easy task over the last few weeks, but we acted promptly and quickly and implemented plans for the safety and security of everyone in this county. The safety and security of each and every one of you is important to me. Protecting my employees allows for essential services to be continued. Soon I'll be announcing new plans, operating procedures for county offices as we transition back into a normal plan of action. If you have questions about operational services now for the county, if you'll call the appropriate offices or my office for information, we will give you guidance. My Veteran Service Officer, David Smith, will even be doing some Facebook Live posts to help and assist each and every veteran and their family with any services that might be needed from his office. In the meantime, we all await guidelines from the President and our Governor as we groom our new plans of operation to meet our community's needs. Residents, just to warn, this crisis is not over yet. There's much ahead to still be considered, but we can do this. We always have, we always will, we will persevere. We are Warren strong. Today we have the City of McMinnville Administrator Nolan Mean, Hospital Administrator Dale Humphrey, Tennessee Guardsman Sergeant Kaufman, who's at the Health Department testing now, and Volunteer Chair Mental Health Director and Administrator Brian Harriman.
Thank you, Mayor Haley. Nolan Meng, City Administrator, City of McMinnville. We've all had our share of challenges lately, and at the city, a challenge that we've faced from the start of this pandemic is how do we continue to provide critical services that the community expects and deserves while respecting the guidelines from various agencies and the governor and protecting the health, safety, and welfare of our employees and citizens of our community. We started by adopting the 4-tiered COVID-19 action plan. The plan is intended to escalate gradually to proactively respond to changes in the situation while heeding the guidance and recommendations of our state and local public health officials. We're currently operating at level 1, with level 4 being normal operations and level 1 being the highest or most critical state of operations. As the levels progress from 4 to 1, the levels of social distancing and changes to internal operations adjust accordingly, while doing our best to provide continuity of operations and maintain high levels of customer service. At level 1, police, fire, and garbage pickup, also known as sanitation service levels, are unchanged. Public works staff, other than sanitation, is mostly on call or as needed. Water and sewer plant staff, water maintenance staff, utility billing, property tax, and business licensing staff, and Parks and Rec maintenance staff are all on reduced and rotating schedules. Water bills can be paid online at our website, mcminnvilletn.gov, by Dropbox at 101 East Main Street, 202 Bell Street, or at several banks throughout McMinnville that accept city utility payments. The community development staff is working remotely. People can and should continue to secure all required permits and request required inspections. The following are closed: the Civic Center or the mall, including all classes and the gym at the mall, all playgrounds, the skate park, bathrooms, tennis courts, and all ball fields. Work continues on the Civic Center, which is roughly 60% complete. The bathrooms at Pepper Branch Park and Ramsey Park, the dog park near Pepper Branch Park, the City Hall exterior corner repairs, and the City Hall elevator work all continues. Since this started back in mid-May, we've been in reactive mode. New and ever-changing guidelines from various agencies, executive orders from Governor Lee, and local conditions have all guided our response thus far. It's been challenging for us, as I'm sure it has been for most everyone. Another challenge that we see on the horizon is our upcoming budget. How will declines in revenues factor in? This is yet to be determined. That is all I have for today. I want to thank our employees for your understanding, your flexibility, and your unwavering commitment to getting the job done. And thank you as well to the public for your understanding and flexibility as we work through this unprecedented pandemic together. If you have any questions or concerns, please contact us at 931-473-1200 or message us on Facebook. Up next, we have Dale Humphrey, President and CEO at St. Thomas River Park Hospital. Thank you.
Thank you, Nolan. Appreciate that. Again, I'm here to give you an update on the hospital, but I wanted to start first from a community perspective. While the volume of positive COVID-19 cases is trending down, it's important to remember the current number of deaths in Tennessee stands at 152. Current models suggest that the total number of deaths in our state will actually peak around 231. That number is based on our current trajectory, so any additional outbreaks or surges could result in a higher mortality rate. Some studies say that COVID-19 is 10 times more deadly than the flu, and we need to be mindful of that fact as we start to relax some of the restrictions implemented by our local, state, and federal officials. Testing in Tennessee continues to improve and now stands at over 100,000 people tested. Our local health department is providing these tests for free, and the hospital is able to perform rapid testing on hospital patients. I'm happy to report again that social distancing, hand washing, wearing masks and in public, and sheltering in place, especially for those most vulnerable, have facilitated where we are today. Your efforts in Warren County and across the state of Tennessee brought us to this point more quickly than was originally projected and with less impact on the health of our communities and the capabilities of our healthcare system. St. Thomas River Park has continued to function for our community during this pandemic, and our average census over the last 30 days has remained about 34 inpatients. We're thankful to report that none of the inpatients tested for COVID-19 in the hospital have been positive, and of the 5 known positive cases in the county, 3 of those have recovered of the 345 citizens tested. St. Thomas River Park is making plans to resume elective surgeries in the next few weeks, and we want you to feel safe in knowing that we will continue to be overly cautious to ensure the safety of all our patients. Many of you have delayed seeing your physician or in having tests or procedures performed at the hospital. You should be confident in knowing that we take your trust in us seriously, and we will protect you as we exercise compassionate care and caution. We will continue to provide safeguards such as screening of all associates, cleaning and disinfecting all areas of the hospital, limiting visitors, and practicing waiting room distancing, as well as continuing to offer virtual visits from our local physicians as well as through Ascension Online Care. If you have delayed care for any reason, I encourage you to reach out to your physician and discuss how we can be of assistance to you. And our emergency department continues to provide care around the clock. If you are experiencing a life-threatening emergency or difficulty breathing, please go directly to the emergency room or call 911. I'd like to end today just by thanking our associates who have sacrificed and stepped up in this time of crisis to be here for our community. I'd also like to thank Ascension, who, unlike other hospital companies who have furloughed employees, offered pay continuation during this crisis in order for their incomes not to be impacted by COVID-19. I'd also like to thank the members of the police department, sheriff's office, state troopers, rescue squad, and fire departments throughout our community who honored us at the hospital last week. We were humbled by this recognition from fellow heroes on the front lines of helping our community. I'd also like to thank Bobby Cox and the Warren County School System for their donations of PPE and the many others who've donated to the hospital. And I'd like to thank Ben Lohman and WCPI Radio for allowing us to get this message out to our fellow citizens. Last of all, I'd like to thank God for watching over us and answering the many prayers of safety spoken on behalf of our community. We're here for you. We're one community. We're like family, and we're going to continue to do what's right for our community. God bless you.
How are y'all? I'm Sergeant Kaufman with the Tennessee National Guard, based out of Smyrna with the 208th Area Support Medical Company. I've been stationed here in McMinnville for about a month now, working with the health department, working to test Warren County citizens to make sure that we can kind of control the spread of COVID-19. As you probably know, we are there Monday through Friday, testing 9 to 3 every day. When we first deployed out here, we were testing about 10 people a day. In the last week and a half, we've had those numbers increasing. We're between 40 to 50 people a day, and we want those numbers to keep increasing. It's very important to have the tests come in to make sure you're not passing on to anyone else. Just because you're not showing signs or symptoms doesn't mean you don't have it. We already had one come back this past week that had no signs, no symptoms, and they tested positive. So we want to make sure that we're keeping y'all safe as well. Only thing I really have left is I just want to make sure that everyone's staying safe. If you have been tested, you know this test isn't that long. It's a really quick test. It's not really painful or anything, but we ask that you encourage all your friends and family to come get tested as well. Again, we're stationed right there with the health department off of Sparta Street, and then our teams also deploy on the weekends to surge sites to help do some mass testings like we did this past weekend. But yeah, invite anybody out to come get tested. Me and my team are ready, and we will be glad to help. God bless.
Hello, I'm Brian Harriman, Director at Cheer Mental Health, the Division of Volunteer Behavioral Health. As you can imagine, this event has had a huge impact on our mental health and of our community and the individuals. I'm here today to talk about self-care with you and to let you know it's okay to take a few minutes to take care of yourself, because if you don't take care of yourself, you're not going to be able to take care of those around you. First step of self-care is the hand washing and the mask you're wearing. Thank you for doing that. As you can imagine, a lot of people are experiencing some stress and some anxiety tied to this. We don't know stress and anxiety about the disease. Will I get it? Will a family member get it? If I do get it, can I recover? Those kinds of things. Are there services available? Are there tests available? There's steps we can take in the early stages if you recognize what that stress does to your body, whether it's tightening your neck muscles or it shortens your breath, quick breathing, rapid breathing, those kinds of things. You can do some quick tips for that. Things like getting up and going outside for a walk, sitting on your porch, waving at your neighbors, just doing some work around the house, those kinds of things that you have been putting off. I know this weekend I've done some things out in the yard that I've wished to have had time before. I now have time. So I encourage you to do whatever it takes to de-stress you. But I also urge you, if you find yourself in a situation where your stress level is increasing or your anxiety level is increasing, you need to know there are resources here locally in our community that can help you. We have agencies and private individuals that are doing therapy every day, continue to do it. We're just doing it in a little different model. I did bring 2 phone numbers for you. If you statewide cross this line, which is 855-274-7471, that's at the state level. The other one is the helpline, which is to find services in your particular area, 800-560-5767. Thank you.
As you see, our needs are great across the community, and I've reissued my state of emergency until the end of the month to reflect the governor's original safer at home order. In the meantime, county offices will be closed to the public until further notice, with plans to do a soft reopening sometime within the next couple of weeks. I want to commend all of my elected officials, department directors, and employees who have worked on abbreviated schedules, been on furlough, been working from home, but those in particular who have continued to provide the essential services necessary for our community and our residents. In the meantime, as a community, we will continue to plan our strategies and put together a soft reopening for our economy. We will await guidance from both the President and the Governor upon the relaxation of this shutdown that has occurred over the last month. It's not going to be an easy task, but we know that your support is important and crucial in order to be successful in our endeavors. We need to still heed the advice of the health experts, many of whom you've heard today. Continue to test, which is free at the health department. I myself even got tested. We have received more supplies from our front line of defense, and we have the much needed PPE protection now that is needed to protect each and every one of my first line defenders, health providers, first responders, law enforcement, and more of those supplies arrives daily from TEMA. In the meantime, we have shared, we have made do, we have become creative, but we now have at least some of the supplies that are necessary to protect each and every one of my employees and health providers across the community. The Volunteer Fire Department did a hero salute parade around the hospital on Friday, which was well received. And so we want to thank each and every one of them, including Chief Raymond Roberts, for coordinating that. And so it just shows our appreciation and shout out for those people who have assisted so much in what we've done. This return to normalcy will not be quick, as we know. We've got to still coordinate with health and economic restructuring together locally in order to accomplish what our ultimate goal is, to restore the economy and protect the health of all Americans. We all realize the need for public assistance, public health will continue and continue to be great. Addressing the mental health challenges from the stress associated with the pandemic will also continue. We have services available from volunteer cheer mental health and the Public Health Department that will assist in that need. Rebuilding local business is not going to be easy. Supporting our local businesses, which are the heart and soul of the local economy, is essential. Many of you have already done that for the businesses who have remained open, and we wish you continue to do that, but still heed the advice with social distancing and all the things about what we've talked about today about washing hands and taking care to provide some kind of protection for those that are most at risk. So we all realize that we're a part of this formula. Together, we can do this. Tomorrow belongs to the people who actually prepare for it today. And so we want to thank each and every one of you, including the radio station, the local media sources, and BLTV for allowing us to share this information with you. And together, we are Warren Strong. Thank you.